very
Don't have a
warm day,
printer.
call the meeting to order. And have a roll
I
call.
don't,
Peg
I
Bellin,
don't ask every,
Claude Benedict,
Here.
Lurton Blasingame,
Here.
Sue Ashton, Ron Durkop,
Here.
Sandy Kleckel,
here,
Judy Ritchie,
Here.
Julie Maslowski,
Here.
Deb Allison Osby. Here. Jean Wallerman.
Here. Thank you, everyone. This morning, we don't have any citizens in attendance. We will go over the minutes and we'll accept any changes or a motion to approve.
I'd like to ask a question first.
Yes.
On the other business, they calls it, and Mr. Durkoff explained that the grant for dementia specialists was successful, and Winnebago County will be receiving this position as of June the 19th if they voted for it. Did they vote for it?
Yes, they did.
They did. Good.
Yes.
Good. I just wanted, I didn't see nothing in the paper
Yep.
about it. I didn't,
Yes, it was approved with a voice vote, unanimous.
good. Glad to hear that.
Move approval. Second.
All right, minutes have been moved and seconded. All those in favor?
Aye.
Opposed? Okay, on to new business. We don't have a speaker today. Does anyone else have anything to bring forward?
Mercy had their ribbon cutting ceremony of the Durapsych unit last week, was that?
18th, I
The
think. it was.
18th, yes. So they had a great turnout. They're ready to accept new patients. They have the 8 beds ready to go, but they had a great turnout, and it was great to go and listen to how they're going to move forward with providing that care. So
There was a nice article in the paper on that also.
yes, absolutely, and it was on Fox 11, I believe, too. So.
Yeah.
Okay. Deb, we haven't seen you for a while, so any updates that you have to share with us?
No, and my sincere apologies. Literally, I was in Louisville, Kentucky. I've been in Florida. I have been all over the place. So it's actually nice to see all of you again. So one of the things, I think is, as we move forward over the next couple of months, we start as a council the budget process. In our first meeting for budget, believe it or not, is actually in July, and then we start that process moving forward into November. And so I think if there's things that we've identified in which would be instrumental to the implementation of the things that we want to do through the Committee on Aging, we should probably discuss those for sure, over the next month or two.
Okay, thank you. Okay, any other thing new? Then we'll move on to committee reports. Strengthening our partnership with neighborhood associations and other partners. Lurton?
On the 6th, I went and got the file of life from the fire department, and about 16 copies, and then took them over to Pam Rader, who's the new person in charge, the liaison with the neighborhood development associations in the city. And nice to meet her. I think she's going to do a good job, and asked if she would give a file of life to each of the representatives of the neighborhood associations and suggest to them that they may want to share them on the information about that with their neighbors. She said that would be fine, and I expect that she's done that.
Okay, and remember last month we had Tom Eckfall here from representing the Herald. He did a great article in the Oshkosh Herald, mainly on the fire department's presentation to our committee last month. But there's also a very nice article in last week's Herald about Pam Reuter and the neighborhood associations. So there's some good press out there these days. And
Yes, isn't that nice?
okay. And as you've been doing these meetings, are you hearing things that would be appropriate to some of the other committees within our group to be exploring?
Not that I'm aware of now, but if I do, I will pass them on.
Okay. Improve access to affordable transportation and delivery services for seniors. We really haven't proceeded too far. There was recently a commercial saying that CVS pharmacies were going to start doing some delivery, so that's something we'll be checking into. The Hometown Pharmacy is eager to share that information with the community also, as is Amro Pharmacy. The Walmart pickup, where the orders are called in and people are picking up at the store, seems to be going well, from what I'm hearing in the community that others are talking about. So there are some really good things that are going on in that area. Oshkosh Transit has their new buses, had their ribbon cutting, and nice press coverage on that also. So in my personal estimation, good things are happening.
I agree.
Yeah.
Create community design and policy that supports age-friendly community.
Yep, I don't have too much to present. I think just basically tomorrow with the 4th of July and fireworks and everything that's occurring, I think if people do have pets, that's something to be conscientious about. And then just the city ordinances towards fireworks is something that people just need to explore. So other than that, I don't have anything else at this time.
Okay. Improving communication and visibility of available services to seniors. Julie, Ron?
Have anything else?
No, I do not.
Okay, I have a number of things. Some of them are sort of catch up from earlier long meetings, or meetings where we had presenters that took most of our meeting time. One is on the new Medicare cards. They're coming out in Wisconsin. If you haven't gotten yours, and some of us have already, you will be shortly. And the word is that it could take about a month for everyone in Wisconsin who's on Medicare to receive their card. And you're supposed to begin using them right away. All providers who accept Medicare already know about this, so it won't be a surprise to them that you have a new Medicare card. And don't forget to destroy the old Medicare card because it has your Social Security number on it, and you don't want that getting into the wrong hands. And they do warn that scams are continuing. Every effort that can be made by a scammer to try and part you with your Social Security number or your personal information, they will try. So if you get a call asking for any of that, hang up. Second thing is the World Elder Abuse Day that was held on June 13th. We talked about it at past meetings at the Thompson Center at Lourdes in Appleton was a big success too. The Wisconsin Attorney General Brad Schimmel spoke, as did their special guest Paul Greenwood, who is the former San Diego County prosecutor and Elder Abuse Advocacy Hall of Fame inductee. He has successfully prosecuted many elder abuse cases and has trained hundreds of law enforcement and adult protective service staff. One of the difficulties that, Zandy and I, having worked for Winnebago County in the adult protective service areas, is prosecution of elder abuse cases. There are generally all kinds of reasons for it not to get that far, but he's a gentleman who's been very successful in trying to gather the evidence needed and encouraging victims to follow through with pressing charges, etc. We're hopeful that at least one of his presentations can be linked into our senior section in our upcoming City of Oshkosh website update. And Claude, you just mentioned about the Winnebago County Dementia Specialist. Yes, that was approved by a voice vote on the 19th. They're currently taking applications through Thursday of this week. So hopefully we'll have a new dementia specialist in Winnebago County soon. Another item is Take Me Home was implemented on June 1st by the Oshkosh Police Department. I don't think we've talked about that at previous meetings, have we?
It was just briefly in passing.
In passing? Okay.
So
Ron?
you might want to explain that.
What was that called?
It's called Take Me Home. And it's a database for people who need special assistance if they're alone or in times of emergency. Would be appropriate for people unable to speak or properly identify themselves, could become disoriented or act in a manner that could be misinterpreted by a first responder. The system includes a current photo of the person and emergency contact info, as well as any added info provided by the caregiver of the enrolled person. Police can query the Take Me Home database by name or physical description and provide appropriate assistance. It's free and totally voluntary. You think primarily of people maybe who have a dementia, who are living alone at home or something like that, or could wander off as being quite appropriate for this program. Those interested in enrolling their loved one should contact Sergeant Todd Rage at 920-236-5700. That's 920-236-5700. And hopefully we'll hear more about that program at a later meeting.
Right, and that's much more far-reaching than the brief card that was done a few years ago in conjunction with the Alzheimer's Association.
Right.
That was strictly the Alzheimer dementia, where with this program it takes in, people with autism,
Yep.
all the other mental health issues, even some of the more fragile health issues. So, again, it's a very good program to have in place.
This would not be the person who wants to be taken home initiating the call. It's someone else initiating the call.
Generally, someone else initiating the call that so-and-so has wandered away or is in some sort of difficulty. Or let's say we have a natural disaster and there's individuals who are
Sure.
particularly vulnerable, living alone with disabilities of whatever sort. They'd probably be appropriate for this database as well.
Right.
They could access help
Sure.
in those emergency situations.
Or outage and somebody needs electricity for whatever their,
Yeah.
whether it be air
For their
conditioning or
med-
whatever.
Well, at this time of year, yes, the air conditioning, but also a lot of the durable medical equipment that is
Sure.
connected to, a lot of it does have a battery backup, but if you have something like the disasters we've seen in the South in recent years, those batteries don't last that long.
Right.
So it's critical to get to them. And it gives the law enforcement, right in that database, they can flag right away, we've got a disaster in that area, or we've got a fire in that building. And these are the ones we have to get to right away. It's just like in training in some of the apartment buildings, especially the elderly units. If they can't make it down the stairway in case of a fire drill or a fire, that they need to stay in their apartment and, go to the window and something white waving in that window so that emergency personnel can get to them right away. So this is going to cover a whole gamut of those types of things. So, again, a good thing.
I would think that's a program, Lurton, to maybe talk with the neighborhood associations and your contacts with them about, because they would be able to know about elderly or disabled individuals within their neighborhood that perhaps could be referred to this program.
And give me the number again?
Sure, that's Sergeant Todd Range, W-R-A-N-G-E. Okay, it's 920-236-5700. I hope I'm pronouncing his name.
Raggy.
Raggy.
No,
Okay. W-R-A-G-E, Raggy. Okay. Todd. Okay.
Anything else?
Yes, I've got several others, if that's
Good.
okay. So I'll catch up here. The first National Older Adult Mental Health Awareness Day was held on May 18th. It was a webinar presentation because the actual event was occurring in Maryland, state of Maryland, and so I participated in that. It was like a 3.5-hour webinar, which is
Wow, a long time
Long time.
looking at the screen.
They had, there was lots of information shared, but I'm going to just share a few of the takeaways that I thought was particularly of interest. One, it's estimated that 20% of older adults, that's we're talking 65 and older, have one or more mental health or substance abuse conditions.
20%?
20%, which is a lot when you think about that, 1 out of 5. Then you've got 15.2% of the U.S. population are considered older adults. Again, we're talking 65 and older as the benchmark. But 18.2% of the suicide deaths come from this target group, or this group. Males age 75 and older have a suicide rate twice any other group. So quite sobering indicators there. Depression and other mental health behavioral issues are not part of normal aging. I think a lot of older people think that, being old means you're naturally going to get depressed and you're going to have all kinds of mental health issues. That's not part of the picture. Those are issues that should be addressed. 11% of veterans diagnosed with a major depression. That's twice the rate of non-vets, and the suicide rate is the highest in this veteran group. Seniors, or senior centers, I should say, are considered a major source of mental health services via lunch programs, activities, and other things that are going on in senior centers. So it's kind of a hub of promoting mental health in our community. Home-delivered meals are critically important for outreach to isolated persons. They estimated that 60% of home-delivered meals go to people living alone. Many are facing isolation, depression, and anxiety issues in their home. This Awareness Day, the first ever, was kind of billed as a call to action to work together, building partnerships and not silos of intervention. Stigma is a lethal barrier, and programs like the Mental Health Awareness Day were intended to put a light on the mental health needs of older adults. There was concern about the cost of mental health intervention for older adults, and what was commented there is that's blunted by the fact that we are already paying for it by overuse of nursing homes, additional cost of hospital care, and physical health issues in older adults. Also mentioned older adults are encouraged to talk with their physician about their mental health concerns and seek referral to mental health professionals. They encouraged primary care physicians, emergency room staff to screen for suicide and involve psychiatric services right away. The need for more focus on depression in certain subsets of the older adult population that are most at risk, as we mentioned, the veterans. And they said the focus needs to be on educating on what a healthy lifestyle looks like with older adults. And they said, believe it, mental health treatment works, and it even works with older adults. So it was quite an encouraging event. I assume since it's the first ever, there'll be a second, so more to come, and with more emphasis on older adult mental health services as more of us fall into that category with the baby boomers coming through. Another was the ADRC, Aging and Disability Resource Center Committee, met on May 14th. They had representatives from Senator Baldwin office there, Senator Johnson's office, as well as a representative from Glenn Grothman's office. And they indicated that the 2019 budget, federal budget appropriations are in process right now. So good time to let your representatives know what's important to you, was one of their emphasis. They said that snail mail takes 2 weeks to process due to anthrax screening. It has to be done first. So if you send a letter to your senator or representative, don't expect that they're going to get it in a week. It's going to take 2 weeks at least. They said that email is the best method to communicate with your representatives. They said phone calls and emails, all contacts are treated the same as far as how they register those contacts. I said form letters are not recommended, as there will be no personal response to a form letter.
Say that again?
They said that form letters
Yes.
are not recommended, as there will be no personal response to a form
Oh,
letter.
so you don't get an answer back from,
Right. So
Your
if you want an answer
representative.
back, you better call or email. And they preferred the email because then they've got some data, written data to work from. They said that policy staff for each of the offices work in Washington, and the local offices around their district, or the state of Wisconsin in the senator's case, they do the casework on Social Security issues, support for grants, individual citizen advocacy, related to problems that people are having with the government agencies, et cetera. So it was quite interesting to meet with them. And one final thing is the 2018, this kind of goes back a little ways here, the 2018 omnibus spending bill is federal legislation again. It increased funding for many older adult programs. You know, we hear about cutting all the time in terms of what's happening with older adult programs, and this was H.R. 1625, which was signed by President Trump on March 23rd. And that bill included several increases that I'd kind of like to highlight. One is in the Social Security Administration, they increased by $388 million for Social Security Administrative Fund, and $280 million of that is set aside to modernize their IT infrastructure. And another $100 million of that went for reducing a backlog on appeal hearings. So
that's,
trying to,
what percentage of the budget is those 230 million?
the 280 million that was set aside out of that 388. I don't know of their total budget, but this was an increase
Okay.
to the Social Security Administration's budget, and that's how they were going to carve that out for infrastructure and their IT, and also for trying to deal with the backlogs on appeals. Another was the area of health, $49 million for the SHIPS, or state health insurance assistance, for 2018. That's a $2 million increase over 17, but they also noted it's $3 million less than it was in 2016. So the cut had already occurred, and some was coming back. In nutrition, you've heard of the SNAP program, the Supplemental Nutrition Assistance Program. That was actually cut 6% for 2018. Energy assistance, however, there was a $250 million increase in the low-income energy assistance program, for a total of $3.6 billion being spent across the nation. Community services, we hear about the community block grants. They received a $300 million, or 10% increase, to a total of $330 billion being spent in that category. And then legal services and elder justice, kind of a area of increasing budget expense at the federal level. $410 million for Legal Services Corporation. That's a $25 million increase over 17. And then the Older Americans Act, we hear about that with Title IIIB supportive services. They received a 10% increase to $385 million. And then the Adult Protective Services and Elder Justice Initiative received a $2 million increase. So some positive things happening there. There were two areas that didn't get any funding and normally have in the past, and that was the Medicaid Follows the Person. That's a program that helps people who are in nursing homes, medical assistants, relocate to less restrictive settings or home. And the BENES, B-E-N-E-S Act, which is to improve Medicare Part B enrollment process. There have been a lot of efforts to get more funding to get the word out to people that they need to apply for Medicare when they turn 65, even if they continue working, or they may face a penalty for not enrolling
Really? Oh,
in a timely manner, shall we say. So, so that's it. It's
Okay.
probably plenty.
Thank you.
I'd like to ask something there.
Sure.
talking about getting your new Medicare. I got mine yesterday,
There you go.
and people don't be surprised. When I had an old one for years, and you had your social security number on it, you took it off. It's for security reasons. That's why you don't have it.
Exactly right.
You'll get it. This is what it looks like. It'll scare you probably.
Yep, exactly right.
But I'm supposed to throw this away. I'm a type of person. It
And
takes a long time to throw stuff out.
be careful about just throwing it away. You want to
You
destroy
want to
it.
shred it.
You want to
You want to
shred
shred
it.
it or burn it.
Yeah,
I love the birds. I think I'm gonna buy myself a 5-gallon pail and throw a lot of papers and just burn them up and get rid of them. I don't like to throw them out in the garbage because somebody might be beating it up in Appleton or someplace.
Well, be careful of a burn pit in your backyard.
yeah.
I know that, I understand that. Thank you very much, though, for your information.
In talking about the security, and as we're teasing you, probably one of the best investments that we can all make is, at the bare minimum, a cross-cut shredder or a micro shredder. And just keep throwing that mail, even if you just tear off the address.
Yeah.
Is how many junk pieces of mail do we get that has the form inside with, partially filled out with our personal information? So the more of that you can shred and put in recycle, the better it is.
Absolutely.
So that's part of your identity protection. I have two pieces that are reflective of the fire department and equipment that they received in the last few weeks. The first is, and when Chuck was here, he didn't mention any of it. They got it right after. Capital Credit Union, Elevate Communities Program, awarded the fire department $15,050 to purchase 10 sets of ballistic armor, helmets, and accessories for the paramedics. And fortunately, we've not had a lot of it in this area, but with all the shootings and all the other things that are going on, those paramedics are asked to go into areas that are not very safe. And to have the same protection that our police officers have is a very good thing. So that's a great piece for our fire department, puts us ahead of many in the area. So
That's very pertinent in light of that shooting of a firefighter, or two of them, I think,
right,
recently in
Right.
the news, responding to a fire and then being fired upon.
and the fire was to draw them in and to do some harm.
Exactly.
The other is the Leadership Oshkosh Gives Back fundraiser. An $11,000 check was presented to install infrared saunas at the station. And it says it's to cleanse the firefighters of the cancer-causing toxins found in smoke. And there's been a very significant increase in cancers with firefighters in recent years, having to do a lot with all the synthetic materials and the toxins that are included with that. Nationwide, the cancer rate for firefighters younger than age 60 was 10 times higher in 2013 than in 2003. And a 30-minute stay in an infrared sauna after fighting a fire helps to remove those carcinogens. So, again, something that not all fire departments have, but we do. So, good news.
Yeah.
Food Truck Friday. June was very successful. It was between the storms in the early day and storms at night. Jean?
Wonderful event in June. I would say probably close to 2,000 people attended. And beautiful night, a lot of families. So the next food truck is July 20th, and we are adding about 3 more trucks. So there will be more entrees. We found that there were a few lines that were a little bit longer, but very popular food trucks. So that is going to be a plus, so that hopefully the lines won't be as long. But we encourage everyone to come out again. It's a wonderful event, great music, camaraderie with the community, young families, middle families, as well as older adults. So it's a really nice intergenerational event. So come out on and enjoy.
Jean, can you remind our listeners where that's located?
Oh, okay. It's located at South Park, and a little part of it is still under construction, but it is, it's held on the new parking lot, so it's easy access to get to all the food trucks, and we've placed tables and chairs, and it's a really nice park, fun for kids. So come on out.
What time does it start?
It goes from 5 o'clock to 9 o'clock.
Awesome.
I was there that night, and it was beautiful. I can't believe how they're fixing that park up out there. And that parking lot's already got all concrete up. I know they got 3/4% more they gotta do, or 75% more to do out there. But that was fantastic, I thought.
Yep, and it's sponsored by the Friends of the Oshkosh Senior Center, and they all do a wonderful job. And the proceeds from that event go back into programming and items that are given to the senior center. So,
And Don Herman did the trailer, correct? The trailer that's used for the band and some of the other activities? Oh, that's what I understood anyway. And that it's actually donated to the center, not just loaned to the center. I believe that's what Judy Brewer said. So, hopefully that's the correct information and understanding. I'm going to backtrack a little bit to under old business and committees. I had asked Jean the status of the website and the Facebook pages, and there's not a lot of information yet, correct?
correct. But we do have, the Committee on Aging does have two areas on the city website to get to. So if we want to add anything into that section for under the Committee on Aging, you can get to it through the Boards and Commissions tab as well as the Senior Services tab. So if we do want to put things on it, I think we can just go through Bobby, and Bobby can get information onto the website. So we may want to talk a little bit about the protocol and how we want to.
Right, and we've talked about doing a workshop that brings us together, other than at our regular meeting, to go through all of that. In our discussion that we had with IT, with Tony, it was a very good discussion, I think. And having the website that will provide a lot of links to other senior programs, items of interest that are more long-standing, and then also having a Facebook page, a one-way Facebook page, where we can post things that are more time-sensitive, be it the Food Truck Friday, the Senior Expo that'll be coming up this fall, sign-ups for certain events or classes. So there's a lot of opportunity to get information out there. And so with that, what I'm asking of all of our committees here is to start thinking, what types of information do you have with your committee that would be pertinent to go on either the website or Facebook for seniors in our community?
And that's also something that the neighborhoods associations could make sure that people know how to get to the website and where.
Right. And with these connections, with the ADRC, a lot of information they have, the county health department, and they're just as interested in having information from us. So the more that we can do in collaboration with these groups, the more we're going to be able to meet one of our goals, which is increasing the visibility of this committee and more the impact that we have on the community. So the more we can do that way, the better it is. So
Gina, still a timeline this fall for the new website to be up and the Facebook access and so forth?
Yeah, I think I'd have to get that information from Tony. I'm not quite sure exactly what their timeline is. I don't know, Deb, if you know anything more about, I know that they were looking at creating a new one, but I think that task is gonna be,
I can follow up.
okay.
Okay,
In the meantime, though, we should submit whatever we're interested in having on the current website to you,
To Bobby.
to Bobby. Okay,
Just go to Bobby.
okay.
okay, thank you. Any other business?
I'd like to ask a question. When we started our committee meetings, through the city, I think they donated $5,000 toward the Committee on Aging. Was that, or was that given to the senior center? Remember, I think you were involved, wasn't there $5,000 taken out for a fund for,
Well, we had designated from last budget season,
Yes.
I think it was like 2,500.
2,500?
Yeah, but that went towards Walter for the strategic planning
Okay.
that we did, that process. So that's what we had allocated that money for.
Very good. Are you using it for it then?
That's, yeah, so when Walter came in, when was that? That was February, I think?
A while ago.
Yeah, February.
Oh, okay.
Yeah, so when he came in and we went through that whole strategic planning process and we had like some of the department heads come in and we kind of identified, kind of, and almost kind of like a roadmap for how we were then gonna execute. That's what that money went for.
Okay, thank you.
Normally, we have nothing allocated. We're strictly advisory.
Right. And so that's where I was saying, like, if through this process, there's something that we see perhaps with neighborhoods or, something of that, of course, I can't guarantee it because I'm only one of 7 people. But, if there's something that we identify that would be helpful or a tool or something like that, especially if it's something that interconnects, with our other areas to be able to get messaging out, to our older population, now would be the time to discuss it so I could try to advocate for it for budget.
So everyone start thinking about and get it to, probably funnel it to me and I'll get it to Deb. Your ideas of what your committee would like to see done, what may or may not involve funds, and we can proceed from there. Okay, if there is no other business, our speaker next month is Dr. Newman from Aurora, as was said earlier, and hopefully the new palliative care nurse. That was a special request from Peggy Bellin, but I've heard it in the community also. There's a lot of misunderstanding palliative care versus hospice care, and those questions can be answered for us. So our next meeting date is August 7th, 2018. Any other business? If not, I'll take a motion to adjourn.
Motion to adjourn.
Second?
Discussion? All those in favor?
Aye.
Opposed? Thank you, everyone.
Okay.